What about the actual bearing surface itself? So again, correct me if I'm wrong here, the traditional kind of knee replacements are cobalt titanium, is that right? In terms of the metal that we're using?
Yeah, that's correct.
And do you see the future going down any other routes in terms of the bearing surface, in terms of getting into things like pyrocarbons and the ceramics, and like they've done on other joints and shoulders and hips, for example?
Yeah, so I think, certainly in hip replacements, it's very accepted that, again, there's a trade-off with all bearings. But ceramic generally for younger patients, ceramic, hard and soft ceramic on poly is probably considered one of the key bearings. Some people would do ceramic on ceramic, and ceramic has come around because it's a harder wearing, much smoother, much shinier, more wear resistant effectively. Yeah. I think in knee replacements they do have ceramic knees. Ceramtech, make it a ceramic knee. I don't, there's no real data to show it has any significant advantage. And traditionally we use a cobalt chrome knee, which is ultra shiny, ultra smooth on the femoral side, a cross-linked, high molecular weight polyethylene, sometimes vitamin E infused, and then a titanium base plate. The tibial tray is generally considered titanium. And all these things have, again, a trade-off. Titanium has the closest modulus of elasticity to the bone, and what that really means is that it can sort of, we all know bone undergoes, creep, and there's micro movements. It's a living structure, whereas harder metal, steel, titanium, they don't move as much, whereas titanium has a modulus elasticity which is closer to bone than some of the harder metals, and that has a benefit. But then it can have a trade-off as well if you're using it for example, trauma and plate fixations. Then sometimes it can be useful. You want a little bit of micro movement. Sometimes you need absolute stability, and you want a stainless steel type plate. So there's trade-off with all these things.
Yeah, so it's a complex issue.